Hey guys, what's going on? Tony Maritato here. In this video, I want to talk about deciding whether you should contract with Medicare Advantage plans. So many of you are either already contracted with Medicare Part B or you're thinking about becoming a contracted provider, PT, OT, SLP, but really this even applies to non-rehab related professions. A therapist was asking me, should she consider joining or contracting Medicare Advantage plans? So first, let's just cover a little overview of Medicare versus Medicare Advantage. Medicare Part B, traditional Medicare, covers outpatient therapy services. Once you contract with Medicare Part B, you're allowed to deliver services either in a clinic you own, rent, or lease, or in the patient's home. You're not allowed to provide therapy services in other locations unless they are associated with your provider contract. For Medicare Advantage is actually Part C. It is not Medicare Part B. A Medicare beneficiary cannot have concurrent Medicare Part B and Medicare Advantage. It's one or the other. The most common scenario is Medicare Part B beneficiaries will surrender their Medicare Part B coverage to sign up for a Medicare Advantage plan. And as a provider, if you are contracted with Medicare Part B, there are a couple rules that oversee you working with Medicare Advantage beneficiaries. First, if it's a Medicare Advantage plan that has out-of-network coverage, you are allowed to treat that individual. You are allowed to submit a claim on that individual's behalf, but you are limited to what you can collect to what the plan allows. If the Medicare Advantage plan is an HMO, you are allowed to treat that individual. There's no reason to submit a claim because it's an HMO and you're not going to be covered as an out-of-network provider, and you are not limited to what the plan allows. You can charge your full cash rate or your prompt pay discount. Okay, now that we got that out of the way, talking about the decision to become contracted with Medicare Advantage plans. Yes, it broadens the scope of patients that you can see, patients that you can provide service for, and patients that you can bill for. But if you don't have the infrastructure, having more patients and more patient referrals does not help your business. So I am the owner of a outpatient physical therapy clinic. We have 2 clinic locations. We have an administrative team. We have a clinical team. When a new patient comes to our clinic, we accept all local insurance plans. But that's because we have the infrastructure. We have individuals who can verify coverage, who are experienced in submitting claims. We have systems in place that allow us to know if it's a Humana Medicare Advantage versus a United Healthcare Medicare Advantage, what we can expect, what the reimbursement's going to be, what kind of regulations and compliance are required for us to work with those individuals. We know how to verify coverage quickly. We know how to estimate the allowed amount. We know what the copays are going to be. And we have people in place to handle that stuff. If I was a sole practitioner with no administrative staff, no help of any kind, I probably would not go down the road of contracting with Medicare Advantage plans, because the reality is there are more than enough traditional Medicare Part B patients that would keep you busy in perpetuity. To think that you need to expand out into accepting Medicare Advantage without a clinical administrative team, I think you're making a mistake. So I always say, like, my business is really a billing and collections business that delivers physical therapy services. If I was solely focused on being the best physical therapist and not building a medical billing, insurance credentialing business, I probably would just stick with self-pay patients, traditional Medicare Part B, and not dip a toe into that water. But if you want to grow, if you want to scale, if you want to build a business that you can sell in the future that has these contracts in place, of course, consider it. Think about it. But if that's not your focus, don't lose sight of the goal. So in most cases, I coach, explain, recommend small operations, single owner operators, probably not worth you going through the contracting process with Medicare Advantage. Let those patients go see in-network providers, and then if they still want services that only you can deliver, let them pay out of pocket and come see you for the specialty, because you are not the standard of care. You are likely far above the standard of care, so don't expect minimum standard of care reimbursement rates. I hope that was helpful. I'll catch you on the next video.